All right, Dr. Nicholas Mercer with uImproved PT. I have my younger brother here, not my little brother. He's bigger than me. My younger brother, struggling with some adductor tendinopathy, tendinitis, and we found some restrictions in the hip. But Adam, tell us a little bit about what those restrictions have been. What have your symptoms been like?
Just very tight hips, discomfort and pain when I get too low into my squat, and also when I walk, it just sort of feels like this side of my hip is grinding, and they just don't feel open. They feel very tight.
Right, and he has a history of some restricted rotation in the hips, which is a lot better. Main restriction we found today was an internal rotation, right? And so, you know, we're related. I've had similar problems, so I kind of have a good idea of what's going on here. So what we want to do is get those hips more mobile, let that tendinitis decrease over time, get it used to being loaded in those deeper squat positions. But in order to do that, we first have to get the tendinitis to go down, and a lot of times we get extra stress on those adductor muscles when we have a restriction in the range of motion in the hip. So we're going to show you what we did for him today, which was a lateral mobilization for his hip with some internal rotation. And then I'm going to show both him and you guys what you can do at home to try to get more internal rotation. All right, so basically we got Adam in a supine position. The leg that we're working on is up. You can use a few things for this. I use a gait belt. We're just going to wrap that around the leg and around my booty here. All right, getting it down as low into the hip as we can. And then I'm going to provide a lateral distraction towards me to let that femur glide laterally in the acetabulum. And while I do that, I'm going to give him a little bit of internal rotation. Okay, so we're pulling out, keeping that knee where it is. Internal rotation. All right? And I'll probably do this like 10 to 15 times. We already did it today, so we're just going to do a few, and then I'm going to unattach us. We're going to check out his internal rotation here. All right? It's a little better than when he came in. Not quite normal, but it's uImproved PT, not uNormal PT. All right? So now, Adam, you could come in every day to see me. And as much as I like seeing you, you probably don't want to have to come here every day. So I'm going to show you what you can do at home. All right, so this is our legs. So what Adam is going to do is he's going to hook his leg through this band that we have attached to the door so it's not going anywhere, right? He's going to go down on all fours. So now you'll see his beautiful face. And we're going to get this band as high up into that hip as possible. So right there, he's going to rest his knee on the ground. So he's locked in here. So now we've got a few things going on here. We have that band pulling the joint laterally for a distraction that way. We have gravity pushing the femur up through the back of the hip to get a little bit of the posterior capsule involved too. And now what Adam's going to do is straighten out his right leg all the way back. And with that pressure still going through that left knee, he's just going to go back and forth between internal and external rotation, right? Yeah. So he'll do this a few times, and it's good to get this movement in with the lateral and posterior distraction, because if that joint capsule has a restriction in it, our rotation isn't going to be as good, right? So he'll do that quite a few times, and then he'll stand up, test, retest, see if it feels better. But that's the plan for him. And over time, we should see those hips getting better.